All right, welcome. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber, and I am welcoming you to this week's food service, restaurants, events, and hospitality session. It'll be the last session on Tuesdays for your group, and we'll talk about the new schedule later in the presentation. Again, if you have questions, please put them in the Q&A feature or the chat. And we hope to answer those and some additional questions that have come in during the week. At this time, I'm going to hand it off to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne, and thanks everyone for joining us. So I just want to start with a little bit of overview. We're going to look at the long-term outlook again, as we have for the last couple of weeks, talk a little bit more about the public health order and the mask orders that are out there for all of us. And then we will get into sector-specific information and Q&A after that. So in terms of where we are and where we're going, the public health orders are here for the long term. And that is because we don't have a vaccine or a successful treatment, and we have not reached herd immunity. So it will be likely months before we move into something more approaching what was around in January and February. And in terms of an epidemiological update, we are asking that businesses adhere to Boulder County Public Health protocols when dealing with outbreaks. You can find all that information on our website, how to do that. Contacting our department is the best way to get that information, and also let us know what's happening, and then we can reach out to you through multiple avenues to try and get information to you. And the reason I bring this up is that there's been some cases where businesses have required employees who have tested positive in the past to test again before returning to work. And that is not, it's not recommended. And the reason for that is that there can be dead virus remaining in the body that can result in a positive test, which would just delay the employee's return to work, which has an impact on all of us. So I think the recommendations provided by BC Public Health, as well as the state and the federal government, are that once they've completed their isolation and no longer have symptoms, they are safe to return to work. In terms of our public health order, we are still, and have been for a number of weeks, under the 8th revised public health order, Safer at Home. And this is, again, will remain in effect while Protect Our Neighbors is also in effect across the state. And we may or may not continue to see revisions. I suspect they'll continue to make small changes over time. In terms of Protect Our Neighbors, which opened up for application beginning of July, it is the next phase following Safer at Home, and it does provide more opportunities to have more people in some spaces, but it doesn't really change how we operate as a community and as businesses. I would also say that, just reminders here, communities must apply to enter Protect Our Neighbors, and Boulder County does not yet qualify, and it may be some weeks before we would actually be able to apply to enter Protect Our Neighbors. But we do not know when exactly that would be, and we also don't know how long it will take for the state to accept our application if and when we do apply. So in the meantime, we're in Safer at Home, and we really need to think about our behavior as a community and as individuals. And so I want to spend some time talking about some of the statistics that are out there, some of the data that we're seeing, to try and help understand why we're operating the way we are, both as a community and at the state level. So in terms of choosing activities, one of the things that the state is really pushing, and that we're also asking people to recognize, is that the activities you choose to pursue have different risk levels, and those risk levels then echo back into the community. And one of the things that I think it's really important to recognize is that if you stay close to home, if you do outdoor activities, if you stick in within your community, you're reducing the risk to you and to those around you. And so one of the things that we're increasingly seeing across the country and throughout the state is sort of the question, what can you do outside? What are the activities that you can pursue, and what can you what business aspects can you move outside that could allow you to do more? And I wanted to show this to everyone. It's the results of one study that has not been peer reviewed, but it reflects a lot of the consensus from public health officials out there. And I don't think the numbers are nearly as important as the difference between the likelihood of getting COVID-19 indoors versus outdoors. It is just a lot safer to be outside around people. And so businesses and communities have been looking at what sort of things can you do outside. Any of these various activities could be done outside and allow you to have more people and allow the event to take place in a safer fashion. With that, I'm going to totally switch gears, talk about another aspect. If you'd like to think of this as sort of the social distancing or the social distancing aspect of that, I think the other part of staying safe is the face coverings. Like it says here, wearing face coverings along with social distancing and hand washing are, it's the best way to protect us and your community against COVID-19. Wearing a face mask also sets a good example and helps protect vulnerable populations. Face covering orders. The county has a face covering order and it is in place indefinitely. And that covers all businesses in the county. There are local ordinances in many of the cities, and I encourage you to check with your specific city to make sure that you're adhering to the local ordinance, which sits on top of the county ordinance. It necessarily has to be stricter if it exists on top of the Boulder County face covering order. And finally, I just want to sort of dig into some of the resources that we have. The face covering script was developed by our team to provide guidance for businesses who are experiencing a lot of customers saying, how can I access your facilities, your services without wearing a face mask, and it sort of walks you through how to have that conversation. In terms of resources, there are a ton of resources for face coverings, for all sorts of parts of this on these websites, both our website, boco.org/COVID-19 business, as well as covid19.colorado.gov. In terms of, and just to sort of jump back into the face covering issue, this is from a study that came out last week, I believe, or maybe the week before. Goldman Sachs did a sort of an economic analysis of face covering orders and found that lockdowns would subtract nearly 5% from national GDP, whereas face covering orders have a similar effect on reducing the spread of COVID-19 and have a much less deleterious effect on GDP. Last thing before I switch, we switch to the the sector-specific information. This is a study that tested various face covering technology, and again, I want to point out this is just one study, but I think it's a neat visual that I wanted to point out. And so what they did was they created this setup, and they used a laser sheet of paper to show where airflow is happening when you cough into the air or with a mask. So this is what a cough looks like in the air after, if it's unobstructed. And note the time span on the right-hand side as well as the distance. If you wear a bandana, the time is much, these are short, like if we go back, you can see at 2 seconds without a mask, it's 3 feet away from you. The face mask at 2 seconds, and the scale is up here in the right-hand corner of this top slide, it goes about 1.5 feet. With a homemade mask, one of the more complex masks, similarly at 2 seconds, it barely leaves the mask, although you can see some airflow around the face. And then finally, with a commercial mask, it barely gets out at all. And I think, again, this is mostly just to show you visually what we're seeing. But I think it's important to show these slides because it helps us understand the value of mask orders and mask order compliance. With that, I'll get off my soapbox and hand it over to Zach.
Hey everybody, Zach Lustgarten here, Boulder County Public Health. So I just wanted to start today's food service updates with, as I've done in the last several weeks, giving you the most up-to-date resources that are available. And so here you see the CDPHE website under restaurants and food services. And this is going to give you everything up to date on the latest and greatest. Currently, we are under the 8th. Don't mind forwarding the slides. We're under the revised order of Safer at Home. And I have failed in the last couple weeks to give you a really good idea of everything that's in that order. We've only talked about updates. So today I wanted to not only give you the most up-to-date or the biggest, but also higher order itself. So I'll start with restaurants. Indoor seating is 50% or 50 folks, whichever is fewer, as long as those tables are 6 feet apart. The other change that we had seen a couple weeks ago was that these extra large venues, if you have more than 7,200 square feet and you would like more than 50 patrons indoors, then the order has allowed for you to use the social distancing calculator. And we have a link here, and that would go up to 100 patrons total. So click that link. I'm sure we'll talk about it more in the coming slides, but it is a valuable tool that will assist you if you have an extra large venue and you would like to have more than 50 folks indoors. Another point that they have really just highlighted is that seating options are only available if you have a separated section. So the bar should not be used for seating if you have a bartender that is serving drinks and preparing food. If you do have that situation and you have it segregated, you are allowed to have seating there, but it has to be very clear separation. So more than 6 feet of separation, completely different areas of the bar, in other words, and we can go into that a little bit more as we go through the other highlights. So as I stated it with indoor dining service, this is the stuff that's been in the public health order for a long time now, but I just want to highlight it. Different parties should be 6 feet apart. Table spacing needs to be 6 feet apart. And then you want to ensure maximum ventilation by opening windows and doors, minimizing the reliance on your air conditioning. I mean, now that we're in the summer months, open those windows, open those doors, and allow for good airflow. Deep cleaning and disinfecting should be done on shared surfaces between parties and at each turnover. And then you want to keep parties together. So there shouldn't be any intermingling of different parties. Moving on to outdoor dine-in service. Again, different parties more than 6 feet apart, table spacing 6 feet or more, but there is no cap here on seating capacity. So as we talked about it indoors, there's 50 or fewer or 50%, or you use the social distancing calculator. Outdoors, we're looking for just appropriate social distancing, right? So those tables have to be 6 feet or more apart. And really, if the space allows for it, you can continue to go upwards of, whatever your space allows for. Again, you want to work with your local municipality. We've seen some really cool outdoor dining services taking place in places like Louisville and downtown Boulder. So check those out, but you definitely want to check with your local building department. Moving on to our next slide. Party sizes. So those tables need to be 8 or fewer folks together. And again, 6 feet apart. The other bit there would be that you need to not allow for congregation of parties in your entrance and exit areas. They really should be outdoors and, again, appropriately distanced. So if you have floor markings indoors, you should have them outdoors as well when folks are waiting to enter the building. Even better, it would be a text system that you would send to parties when they are ready to be seated. So folks really should be in their cars until their table is ready, at which point, you send a text or some type of alert, and then they come to their table. There's no communal seating under this public health order. There's no self-service stations or buffets, and there's no seat yourself. And as I stated earlier, folks should not be sitting at the bar unless, or if it is being used to prepare food or drink, unless it is designated separated space. If you have any tables that you are unable to take out of the building and they are within 6 feet, you would just want to mark those as closed so that folks are not able to sit at a distance less than 6 feet. On our next slide here, we just talk about signage. Signage should address illness. So if you are ill, do not enter type signage, hygiene and sanitation expectations. And then something that's been coming up quite a bit surrounds restrooms. So as we see folks moving more to these outdoor seating situations, the question has come in, if I'm not providing seating in my restaurant, do I have to provide restrooms? And the answer is yes. The answer is yes. If you are providing any seating, you should provide restrooms. And with that, they need to be disinfected every hour. If you have urinals or stalls that are closer than 6 feet distance, you should close those so that you allow for appropriate distancing. And providing hand sanitizer at the check-in area and throughout the venue is highly recommended, and something that we've heard issue with. If you happen to have darts, pool tables, shuffleboard, arcade games, board games, things like that, things of those nature that are going to be shared and used by different parties, those are not allowed at this time. If there are tablecloths on your tables, you really should move to single use, but if not, then you need to remove them and replace with laundered tablecloths between patrons. So what we're trying to do here is just minimize any kind of objects that would be touched by different parties. For employees of restaurants, there should be temperature monitoring in place and symptom screening questions where possible. This CDPHE symptom tracker is a great tool that I would highly recommend. And then another question that we're getting a lot of, this is still in the public health order, that you should appoint 1 employee per shift to monitor staff and the public for adherence to safety measures. So even if you're a fast casual restaurant, you have to assign a staff member that prevents folks from just sitting anywhere in your restaurant, because we need to make sure that tables are being cleaned, sanitized, or disinfected between parties. And in order to do it, you really have someone seating those folks, and also just making sure that the staff and are adhering to all these safety measures. Obviously, employees are sick, they need to stay home. And if you do have sick employees, contact us. We will talk and walk you through what steps to take and how you can get those folks, and make sure that all the rest of you at all times. I know that we have tight kitchens, but if we move some way, thank you. The ways that we can address that are workflows, shift cohorting, staggering of shifts. So only necessary folks are in the kitchen at one time so that you're not overcrowded. And another thing that you can do is simplify your menu so that you don't have 60 items that you're thinking about making per night, and you have additional staff in order to address that. Another thing, shift cohorting, staggering of shifts. If you do have someone on your staff that becomes ill, by utilizing these techniques, you're going to reduce the amount of people that are exposed to that individual, and you're going to be able to stay open. Because if you have too many folks in a small space at the same time and one of them becomes ill, chances are they're all going to need to quarantine at that time. Face coverings are required for all staff at all times, 8 hours a day. I understand it's difficult where we're at right now, not only in the restaurant industry, but in the world. And as Jesse highlighted very clearly, Boulder County has a face covering mandate in place indefinitely. Gloves are required anytime that you are handling ready-to-eat food, and frequent hand washing should be done every 30 minutes, including upon arrival and departure. That doesn't mean you have to wear gloves at all times. It just means that you need to wear gloves with ready-to-eat foods and hand washing as you always would in a restaurant. Moving on to our next slide. I kind of highlighted this, but we're just following the Colorado Retail food rules and regulations, which say don't work sick. You wash your hands often, you change your gloves between tasks, and you use a fresh pair of gloves after each hand washing. As I mentioned earlier, simplify that menu so you don't have an overwhelming amount of folks in the kitchen at one time. Everybody should be physical distanced as far as employees go. If you have meetings every week, consider doing them virtually or outside. And then your staff should take all their belongings home with them every night. And if you can, provide high quality face coverings for employees as much as possible. For customers, there's sign-in system in place by this time. And that's if we have any type of exposure that has, or outbreak that's occurring at your facility, there's a way to do contact tracing. I mentioned earlier technology solutions for text on arrival, but also mobile ordering and menu tablets where you can just scan a barcode and see the menu. You want to prevent or eliminate any kind of shared use items. So menus are a great example of that. Establish waiting areas, as I said, outdoors preferred, and even better in their cars with text upon their table being ready. Sit down only for restaurants. There's no standing or congregating in the bar area, entrance, exit area. Continue to push curbside and pick up delivery options where possible. And the big one, request facial coverings to be worn by customers when not eating or drinking. So when we go out now anywhere, you should have a face covering with you. So those face coverings should be implemented at all times other than eating and drinking. And you should consider refusing service to those customers who refuse to adhere to these hygiene and physical distancing requirements. If there are individuals that can't adhere to them because of medical conditions, you should offer them options such as takeout. Bars and breweries at this time that don't serve food from a licensed retail food establishment are continuing to be closed for in-person service. And our next slide highlights how they can continue in-person service, and that would be if they adapt to operate like a restaurant. So they have to offer food from a licensed retail food establishment for on-premise consumption. We're not talking about buying frozen pizzas from or chips from Costco and offering those as an option. We're talking about a retail food establishment offering food to those patrons. I've harped on this enough, but only allow bar seating options if the bar is not being used for bar service, or there's a designated and separated section of the bar that can be used for that bar service. Again, bars and breweries that are adapted to this retail food establishment model, they're extra large, they can use the social distancing calculator. And then all bars and breweries may continue to go curbside or delivery service. All right, and then very quickly, performers and competitors. We've talked about this over the last couple of weeks, but if you have any performers, so if you have some music in your establishment, they just have to be 25 feet from patrons inside or outside. And participants, or your performers, should also have their symptoms checked just like any other employee that enters the building. Install barriers where possible so that we're minimizing those aerosolized particles. And yes, I said aerosolized particles from those performers. Maximize those physical spacing between performers on stage. So different instruments should be at least 6 feet apart. And they should use a separate entrance and exit where possible. And they're not included in your capacity limits as long as they're not in your dining space there. They're that 25 feet from patrons, then we don't count them in your capacity. Finally, disinfect those high-touch areas such as microphones, instruments, and props that are being used in between use. And I think that should end my time, so I'll pass it on to John.
Good afternoon, everyone. John Holste, Special Events Coordinator with Boulder County. I'm going to start with short-term rentals again, and then we'll dive into events and life rights ceremonies next. Short-term rental guidance has not changed for quite some time, but we'll go over it again today just for anybody who may have missed it so far. So ultimately, owners are responsible for ensuring that that property is properly cleaned and sanitized between guests. To do so, we really advise you to avoid scheduling back-to-back stays whenever is possible, to make sure you have at least 24 hours between guests to properly clean and disinfect. So you're not rushing, somebody checks out at 11, the next person's checking out at 4, maybe cut some corners, don't clean it as thoroughly. Really, making sure that place is clean when the next guests come in is a huge priority. Removing any of those soft shared objects that are a little bit harder to clean if possible. And then providing some kind of no contact checkout, check-in situation. At the very minimum, you have to maintain that 6 feet of social distance in the check-in. Make sure that guests are wearing a face covering and that are aware that there's a face covering order here in Boulder County. They could be coming from different parts of this country that don't have face covering orders or aren't used to wearing a face covering. So just reminding them that, hey, here in Boulder County, the rule is a face covering is required anytime you can't maintain that 6 feet of social distance anywhere in the county, including outside. So, your help in reminding guests of that face covering order is greatly appreciated. And then, if you can have a generous cancellation policy in case somebody does show symptoms that they can cancel and get some kind of money back and not just show up and potentially show up as an infected person. So. Same links that we've had for a while, both to the CDC and the state's safer at home guidance for short-term rentals found here. All right, events. So, like I've done the past few weeks, we're going to start talking about all events, and then we'll break it up a little bit into life rights ceremonies, so weddings, funerals, bat mitzvahs, those kind of things, versus everything else. So, but for all events, if you're sick, you need to stay at home. And if you're vulnerable, you're strongly recommended to stay at home. So if you're in those vulnerable at-risk groups, please encourage those folks to stay at home and maybe join digitally with some kind of web streaming option or something else. Face coverings required for all attendees, all employers, all operators, unless it's going to inhibit the person's health. And then for any event, you need to develop a plan for symptom screening, for a plan for cleaning bathrooms and your high-touch surfaces. How are folks going to arrive and maintain social distancing, and then how are they going to depart? You need to have social distancing and some kind of traffic flow thought out so that there isn't just a big bunch of people or a bottleneck at some point. And please, please, please collect contact information in the form of a sign-in sheet, an RSVP, an online ticket, whatever it is, so that in case there is some kind of outbreak, we have contact information for an exposure and we can get a hold of everybody. Zach already mentioned some of the limits on performers. They're the same. There's no difference in performer guidance in events versus what he mentioned in restaurants. So we'll skip that piece there. So life right ceremonies and places of worship. Indoors, up to 50 people or 50% of the venue's capacity, whichever is fewer. And you need to use the social distancing calculator to figure out what the capacity of your space is. There is no minimum, I can have at least 25 no matter what, no. That's not how it works. You have to use the social distancing calculator to determine what the capacity of your venue is. And then for outdoors, it's up to 175 people. You need to follow the state guidance and use that calculator to determine that maximum occupancy. If you're going to have over 175 people in the life right ceremonies, then you need to submit a plan to us. Now, something that I mention every week here at this point is that you could have an event, let's say a wedding, that needs to follow two sets of guidance, and that would be the life right guidance for the actual ceremony itself, but then the reception or associated party that would follow that would have to follow the special event guidance, because the wedding reception is not considered to be a life right ceremony. It's considered to be a special event. So you could have, that's one example of a situation where what we would historically have thought as one event, a wedding leading into a wedding reception, is being treated as two separate events under the state's guidance. So events, everything else that's not a life right ceremony needs to follow the special events guidance, which says for indoors up to 100 people, again, using the social distancing calculator to calculate that maximum occupancy, outdoors up to 175, period. And then, again, using that social distancing calculator to determine what your actual occupancy is. And then all events need to comply with any local codes, any ordinances. You might have some permitting that needs to happen depending on what municipality you're in. Mask orders, anything like that, they all need to comply with any additional restrictions that aren't explicitly called out here. So our most recent guidance from Boulder County is found at these two links. The top one is for special events that aren't life right ceremonies or aren't places of worship. The second one is places of worship. In both of those two, there are links back to the state's most current guidance as well. There's also in the special events guidance, links to the state's guidance on food service, which Zach mentioned, because there are portions of certain events that would need to follow that guidance as well.
Thank you, both Zach and John, for that. And I just want to close out here. I'm keeping my camera off because my connection slowed down significantly. But I just wanted to really highlight a big change for us and for our webinars to everyone. Since there has not been much change in the public health order over the last number of weeks, and since we've had a lot of opportunity to talk about these and answer a lot of questions, and those are all recorded, we are going to a new format in the coming weeks, and starting next Wednesday, we're going to have a general updates and guidance webinar at 3 p.m. That'll just be going over sort of the first couple slides from this presentation. That may change week to week, but it'll be sort of a general guide to how the county is enforcing and interpreting the public health order. At 4 p.m. on Wednesdays, we will hold a space for a special session, and those subjects will be decided before, in enough time for people to sign up. But they will not always happen, and when they do happen, we'll announce them in advance. And then finally, the Spanish language sessions will continue. We'll be recording a version, a Spanish language version of the general updates and guidance presentation, and it will be released the following day. And the link at the bottom here is to sign up for those sessions. And finally, the one thing that hasn't changed, or the two things that haven't changed, I guess, are the ways to get in touch with us. The phone number through the call center or our email address. And again, the hours have changed, and I will update that slide in the future. But yes, we're now down to 9 a.m. to 2 p.m. on for the call center. With that, happy to answer questions.
All right, thank you guys. So I have a few questions that have come in. So one of the questions, so this will be for Zach. Many restaurants are telling customers they don't have to put masks on once they're at the table, but how do we help protect staff with this? Are there better masks to wear as staff? How can we have the protection go both ways? And I guess another question is, should restaurants be telling patrons not to wear their masks once they're seated?
Yeah, sorry, I'm gonna leave my camera off as well. Seems to be we're all having bad connections today. But to answer that, yeah, patrons should be wearing those masks anytime they're not eating and drinking. As a business, I see where it could get quite contentious, but that is why we are distancing those tables 6 feet apart as well. So face coverings and distance are the best cure here, not cure, but best option. So your staff really should have limited interactions with tables. And as far as what they should be wearing, high quality face masks, as Jesse showed, are going to be more effective than a bandana or something of that nature. So if you have the ability to provide those N95s or equivalent, we would recommend that.
And part of the message is the people at the tables, if you're wearing your mask, it is protecting the staff as well as when they're coming by. I know I've seen restaurants where the staff will stay 6 feet away when they're asking, how is everything? And they're just dropping off food and they're asking the patrons wear the masks, at least when the staff comes by, and having it available. All right, so John, this is for you. I think the next two are for you, actually. To be clear, if you're a rental facility and you're renting out to an event, you're responsible for the hourly cleaning of the restrooms during this event and during the day if you even have multi-events in that facility. You're on mute.
Sorry about that. Yeah, that's my understanding. And then the second one I can see. Sorry, did you want me to? You want to read that?
So no, yeah, that's great. But so we just want to be clear that the facility needs to assure that the restrooms are cleaned per the guidance.
Correct.
The second question is there's a little confusion about the max indoors of 100 versus 50, and if you could clarify, that'd be great.
Sure. So you could potentially have 100 people indoors. You would need to have what the state calls an extra large room. So I think the confusion comes from back in the life rites ceremonies and places of worship. They give a limit of 50, and then later at one point they said, well, you can have up to 100 if you have this extra large room. Really the answer now comes down to what does the social distancing calculator say that your space can allow. So, but in no case can that be over 100 persons inside. And you would need to have a fairly large indoor space to have 100 persons.
So for example, we ran this 7,200 square foot facility with 30% occupied by tables and others would be 50 people under the social distancing calculator. So that is a really large facility to be able to have 100 people inside if you have
Correct.
anything else in the room. Okay, so I'm going to ask about how long, put your crystal ball on, your hats, how long, maybe Jesse or anybody else on the call, do you think we'll be doing symptom screening for employees or guests?
No, it is a crystal ball question, but we'll be doing symptom screening until it is not necessary to be tracking and ensuring that the people who come into the business are not sick, if that makes sense. If there's a way to treat people, then that may be unnecessary. But for the time being, without a treatment or a vaccine, figuring out if someone is sick before they have a chance to infect other people is really important. So symptom screening is key to that. And if anyone else has anything to add to that, please do.
Sounds like you answered that one.
All right.
So John, let's go back to that facility versus event, who's responsible type question. The symptom screening. So for the guests, if an event is happening, does the facility need to assure that the coordinators of the events are doing the symptom screening, or does the facility have to do it?
I am not 100% sure on that, to be honest. I'll see if I can find a quick answer while we're doing this, but I may have to follow up.
Okay. Well, while you're doing that, Jesse, maybe you can answer this question. We've heard about these cards coming out in our community where people are showing cards with your logo, our Boulder County Public Health logo, saying they're exempt from wearing a mask. Are those legitimate cards?
They are not at all legitimate. We would not issue that sort of card. We would not put our logo on that sort of card. They're fraudulent, and they, I understand this has happened to a number of communities and with a number of different logos added, and it's just nobody's going to be issuing cards exempting individuals with a printed piece of paper.
All right, thank you. Thank you for clarifying that. Maybe while John's still looking it up, Zach, are people allowed to seat themselves in a restaurant?
No, it's spelled out pretty clearly in the order that they have to be seated. There's no self-seating, and that's where having an assigned individual that is responsible for adherence to the public health order is super important.
Okay. John, are you good to go, or do you want me to ask one more question?
I believe it falls back to the venue. I can't say that with 100% certainty, but when I look at where it's listed to come up with that plan on the state's website, it's under venue and not under hosts or attendees. So to me, that responsibility would ultimately fall back to the venue. You may need to work in conjunction with your host to do that, to come up with a plan that works for everybody. But I think ultimately that responsibility falls back to the venue.
Because ultimately, if there was an outbreak at a venue, that venue would have to then be able to produce the list of people that came into that venue.
Yes, that's correct. Yep.
Okay, so working with anybody renting your facility is important. So,
absolutely.
John, you're the next question as well. For
Sure.
Life Right events with families or households seated together, do we need to space the tables apart 6 feet apart, similar to a restaurant still?
Yeah, and Zach actually hit on a bunch of those things that need to be done. But I mean, one of the biggest things, especially in the associated party or reception, is the current guidance says basically don't create opportunities to mingle. Big example I would think of a lot of those Life Right ceremonies bar mitzvahs, weddings, etc. You typically at the reception or party would have a dance floor and have a DJ. That's really not encouraged right now. It's really strongly encouraged to not have some kind of dance floor where everybody can mingle and get into close contact with each other, which again, I know is a huge departure from what we would have traditionally done in that situation. But all of that same restaurant guidance definitely applies in the sense of a wedding, as an example, a wedding ceremony, or excuse me, wedding reception dinner.
Okay. And then even in the life right part of it, if you have families brought together, they still need to be distanced from
That's correct,
other
yeah.
families, not direct households,
Yeah,
and others.
Yep. You can seat, a family of 4 together, but then there needs to be adequate distance away from the next household.
I'm kind of seeing it, how we all look at seating charts for the wedding reception. There's almost like seating charts needed for the wedding ceremony as well these days, to make sure that you have the seats in proper places for when people show up. All right, so the last question is for Jesse, and then we'll talk about the new schedule one more time. But Jesse, we're getting a lot of businesses concerned about employees traveling to Arizona, California, Texas, Florida, and coming back. Are there travel restrictions either statewide or locally? And what can an employer do in a sense with those employees coming back if you're worried that they were exposed in these high contact areas?
So there are no travel restrictions between states at this time at the state or local level. We do encourage, however, that if you have an employee that went to a state that is having a surge, or just anytime an employee leaves the state or leaves the local community, you can request that they quarantine for up to 14 days. That especially works well if they can work remotely. Maybe they're already working remotely, and then the quarantine is just they need to keep doing that. There are, and I think Zach had a link to information about sick leave and things like that are offered at the guidance on that's offered at the state level for people who are being asked to quarantine because of travel.
Okay. So right now, while the state's still saying limit your travel, there, a lot of this is recommendations to protect other staff and patrons.
Exactly.
I do send out that link specifically to this group about paid sick leave and some of the other resources there. So I will continue to do such. There are no other questions. So at this time, I want to thank our presenters. Thanks, Boulder County Public Health, for continuing to offer these times to answer questions, provide new information. I'm sorry your connections were a little off today, but
sorry about that.
No, it's true. Our internet, it's just proof that our broadband needs to be worked on in order to support more remote work. As a reminder, we are moving to a general session on Wednesdays. Please continue to attend, learn the updates, learn the new cases, learn about the new orders or order updates if there are any. And ask your questions. Just because we're getting rid of, food service only or events only doesn't mean that your questions won't be relevant at that time. Please attend these Wednesday. And we moved them to Wednesdays partially because the governor's known to make announcements on Mondays and Tuesdays. And we're trying to provide ourselves a little bit more time to get that information and be able to provide it to you if there are any updates. So again, continue to attend. We'll continue to record these, continue to ask your questions. And if there is a specific industry update that we need to talk about, or we're still seeing confusion within an industry, we will schedule a Wednesday at 4:00 session and we'll let that industry know. In the meantime, thank you all for attending and we'll see you next week.
Thanks everyone. Thanks, Corinne.